Here we go.
Okay.
Let's do it.
I love it. Well, welcome back, everybody. Welcome to the next installment of the Many Minds podcast, where we encourage collaborative community healthcare using many minds for better outcomes. I'm Alex Davis, physician assistant. I've got along with me, as always, Tyler Murray, nurse practitioner, and the two of us work together at Summit Brain, Spine, and Orthopedics in Lehi, Utah. If you have been with us before, you've heard before, if you're new to us, let me just fill you in. The purpose of this podcast is to promote interaction between the different specialties. We want to learn what makes your specialty special and dig into a few of the topics that we maybe don't get to talk about all the time as advanced practitioners and as other healthcare providers. So what is life like in your shoes, and how can we support you to do a better job at better patient care?
And as a general disclaimer, the podcast represents the opinions of myself, Alex, and any guests that we have on the show. The content from this podcast is not intended to act as a substitute for medical advice, diagnosis, or treatment. We're just here to talk and have a good time. And with that, as always, we're going to jump into the podcast. Today, we're going to be talking about family medicine and urgent care. And we have none other than Steve Ruiz, and he's going to say his last name for us.
I say it Ruiz, but everybody else says Ruiz.
I love it. They told me before it started, you can't say it any other way. Just say Ruiz. All right.
Practice rolling Ruiz.
Ruiz.
It works.
Yeah, we got it. We got it.
Yeah.
But family medicine, urgent care is kind of your wheelhouse. You've been in the game for a long time.
Yeah, going on 24 years.
Wow.
Yeah, I'm an old guy.
I'm going to tell you something right out of the gates here because I need to get this off my chest. So I did a quick bio check, looked you up.
Oh,
this
exciting.
guy has 3-digit reviews. Guess what his star rating is?
At least 3.5.
He's got 5. He cleared the board. It's all colored in. I was
way.
like, this guy's legit. So.
Okay. Well, I'm excited to hear
I
that.
don't check that stuff very much.
Yeah.
Ever. I don't think I have since I started.
Well, there you go. I just gave you an ego stroke for the morning. So
thank you.
Yes, sir. Yes,
Best way to start the day.
Yeah.
Best way to start the
Feeling
day.
great now.
So tell us a little bit then. How'd you get to this point? We want to hear a little bit of your background. Give us a quick intro. What got you here?
I kind of chanced into being a PA. I kind of fell into it. I grew up in a really small town, Mount Pleasant, Utah. I was probably the last generation to grow up without cell phones, and we had Saturday morning cartoons and all that
Love
stuff.
it.
Oh man.
Oh,
Real
yeah.
small
Nostalgic.
town. Yeah, it was great.
Yep.
Cereal
I still
and cartoons.
remember what channel number was which TV program, which station.
But I guarantee I'm a bit older than you guys.
Maybe a little bit.
Yeah, you remember Captain Caveman or any of those?
Okay, you got me.
Yeah,
You got me.
Okay.
So
We were
anyway,
Ninja Turtles.
Yes.
What else?
Ninja Turtles.
Yeah,
Shoot.
I loved
those
it.
Were great.
Yeah.
Right? Heroes in a Half Show.
Saved by the Bell after
Scooby-Doo.
school. Yeah.
Okay. Well, I don't want to date myself any further. But
Okay. Sorry. Back into it.
It was great. But my mom and dad opened a real estate office down there, and we're doing fine until real estate kind of cooled off in the 70s, and they both started working for the hospital. My dad started as an X-ray tech, and my mom was working on the nursing floor. And I am 6 years younger than my nearest sibling, and I was a bit of a latchkey kid, and I think a little problematic. And so my dad, through a kind of a weird series of events, ended up being the head of maintenance at that hospital, because he was the kind of guy who he could turn a wrench on anything and make it work.
Yeah, that's cool.
And so they made him the head of maintenance, and he put me to work. I think more to keep me out of trouble than anything, but it was good. It was and one day I was working. And I heard a whistle outside of the ER door, and the doctor was waving at me. And so I came in, and he said, "Does blood make you sick?" And I said, "No." And he goes, "Your parents work here, right?" And I go, "Yeah." And he goes, "Well, come here. I need your help." And so I went in, and he put a trauma gown and gloves on me, and I proceeded to hold down a very drunk man who had, this will date me, who crashed a 3-wheeler into a ditch.
Okay.
And the handle for the brake had been broken even when he was riding it, but I guess as he went in, it kind of spun and went into his leg, and
Oh man.
cut a really big gouge into his leg, and he was so drunk the doctor was a little worried to try to sedate him, and he just needed him to hold still. And the nurse who was in there with him weighed 90 pounds soaking wet in a snowsuit, and she couldn't hold him, and I was kind of a bigger kid, and I just wrapped up on his leg and started talking to him. I was like, "Hey, what kind of 3-wheeler were you riding? Hey, where were you riding?" And you know what I mean? Just
The art of
talking to him.
distraction.
And we got him all sewed up, and when it was done, he was like, "You're pretty handy. That was pretty great." And anyway, he kind of started to asked me to help in the ER. I'm going to really Reader's Digest this.
Sure.
If I can. I told you this whole story would take forever. And then one day, actually in the ER, the pharmacist who owned the only pharmacy in town at the time was in there kind of grousing because he had to come in and fill. Because what they used to do is put medicine in prescription bottles and leave it in the ER with the script rubber banded around it, and the doctor would just sign it, put it in a box, and give it to the patients if it was pain meds or antibiotics or whatever. But he said, what I need is a pharmacy tech who can help with this. And I said, I'll do it. And he said, you want to show up here at 5 a.m. every day? And I said, sure, let's go. Mm-hmm. So he trained me to be a pharmacy technician before it was a licensed thing.
Wow.
And so I'd been working there and for him at his pharmacy for a few months when the state came out and said, it's got to be a licensed thing. And if you're already doing it, all you have to do is show up and take the test. And if you pass it, you get grandfathered in. So I showed up, took the test, passed it, got grandfathered in. So I became a pharmacy tech for the hospital. And then doing that led to some other stuff. I was being used as an orderly here and there, just moving people around and helping. And anyway, it was a real family kind of a feel at that hospital at the time. And I was going to school and doing other things, and I'd gotten my bachelor's degree, and what I originally wanted to be was a marine biologist. I wanted to
in central Utah.
Well, and that's hard, right? Because
not a lot of direct access to the ocean.
Yeah, but what I wanted to do was study whales and dolphins and scuba dive all day and do that kind of thing, because I'd been scuba diving for a long time. But anyhow, oh man, how do I Reader's Digest this? I fell in love with a girl who I've been married to now for 30 years, and we've been together 34 years, and she didn't want to leave the state, and it's hard to be a marine biologist without an ocean. Yeah. So I shifted gears and decided I'll be a pharmacist because I was doing that, and I found that to be really boring. I was taking calculus and all these big chemistry classes, and I remember one day at work saying, how much math do you use? And he picked up the little spatula and said 5, 10, 15. And I was like, why am I doing all this stuff? Anyway, so I didn't want to do pharmacy. I wasn't sure what I wanted to do. So I thought maybe I'll do psychology because, as you can tell, I like to talk. And so I got into a graduate program in pharmacy after I got my degree and in psychology. And it was destroying my will to live because I was working with some sexually abused children. I started to not trust people. Like a dad would walk off with his kid in the park, and I'd be like, I better follow them. I don't know where they're going.
Boy.
It was messing with me. It freaked me out. So I really was kind of complaining one day, I'm getting to the point, of I don't know what I want to do. And one of the nurses at the hospital said, you should be a PA. And I said, oh, what's a PA? Yeah. And she said, well, Cheryl, who works in the ER in the clinic, is a PA. And I said, thought she was a doctor. And she goes, well, no, she's a PA. So she says, you should go talk to her. So I went and talked to her, and she had me shadow her for a couple of days, and I was bit. I got bit. And I said, well, this is what I got to do. So at the time, the only program in the state was the University of Utah. And I called and said, I need to apply. And they said, oh, the deadline's like a week to apply. And I said, can you overnight me the packet? And they said, sure. So they did, and I filled it out the next day. I got it. I guess it was 2 days, and I filled it out really quick, all in hand, and then you had to write like a 2-page why you should let me in. And I wrote it on my lunch break. I ran it through spell check once. I needed all these letters of reference, so I went to all these doctors that I'd worked around for a long time, and the nursing administrator, and said, will you write me a letter? And they said, when do you need it? And I was like, today. And they're like, okay.
I'll wait for you, actually, if you're okay.
It had to be, I don't know if it's still this way with CASPA and everything, but it had to be sealed in an envelope and with their name signed over it, so you couldn't look at it.
Right.
By the end of the day, I had all the letters, and so I got it all filled out, and I called the lady to say I'm overnighting it back at the program, and she said, are you sure you're done that quick? I said, I'm done. She said, okay, because I already got all my transcripts together from college, and I sent it, and Cheryl, the PA I had shadowed, told me, oh, you won't get in, but they'll tell you why you didn't get in. It takes years to get in, and they'll tell you, and I ended up getting an interview, which was kind of crazy, and I didn't own a suit. The hospital administrator gave me an old suit.
Oh my goodness!
I borrowed a tie from the CRNA that worked there. I went up, and everybody had their game face on. At the time, it was 3 days of interviews up at the U program, and this is back when it was in an army barracks behind the School of Medicine.
Interesting.
So I actually heard one of your guests talk about Gerald Fisher, who had kind of told him, "Oh, you should do what I do. You should be PA." I went to school with Gerald.
Oh, really?
Yeah, we call him Jeet. But anyway,
that's awesome.
Yeah, so I was in his class, but at that point, it was kind of a game face. Everybody was there for this really intense, but I went there thinking I'm not getting in, so it didn't matter. I just went there to get the experience of what it was going to be like, and so I did these 3 days of interviews, and like I was just being kind of really laid back and being a cheerleader in the room for everybody else. Oh, you're so smart, you're going to make it, no big deal. You know what I mean? It's all going to be great. And I didn't know they had a mole who was sitting in the room watching all these people acting like an interviewee. And I guess that was a good thing for me because they're like, oh, this guy really gets along. He's pretty laid back and he really helps people out. And, you know, like one of the interviewees said, out of 80 qualified applicants, and we're only taking 32, what can you tell me about yourself that's going to help me remember you? And I just looked her right in the eye and said, well, I'm not wearing any underwear. And,
no, you didn't.
Yeah, I did. And she kind of, you know, gave me, and then the little red light in my head went off, and I was like, no, I'm kidding. Let me give you a real answer. And she started to laugh hysterically and said, no. And I remember by my name on her paper, she wrote all caps, right? No underwear. And I was like, oh my God.
She asked.
I was making a joke, and you know what I mean? And and anyhow, back then they said it will take, you know, a week to find out if you made it. And if you get a thick letter, it's great because it has all of your applications for student loans and housing and everything else. If it's just paper thin, it's sorry, thanks for trying. Yeah. So I remember I was actually mowing the lawn in this little place we lived. I checked the mail as soon as it would show up, and the guy showed up, and I ran over and took it, and there's this, you know, University of Utah PA program, paper thin. I didn't even open it. I went in the house, and I said to my wife, well, my rejection came, and put it on the table, and she said, oh, I'm sorry, what did it say? I said, I don't know. And she goes, what do you mean? I said, well, I didn't read it. And
of course,
I went in to wash my hands. I think she had just made dinner or something, and as I'm washing my hands, I hear her say, babe, you got in. And I'm like, no, you're reading it wrong. She said, no, you got in. And I went in, and that was the first year that it said, you know, for student loans, go to www. And for housing, go to w. You know, so it was pretty weird. I kind of fell into it.
That's crazy.
Yeah, so I always tell prospective students, if I can make it, anybody can make it.
I love it. We got to get a producer to make this into a made-for-TV movie here.
Sorry, that was a really long story. But yeah, that's how I got into being a PA.
Yeah. That's fantastic. And I can't think of any better background for family medicine than pharmacology and mental health.
Yeah.
So you were primed for family medicine.
It helped.
How did you end up, why choose family medicine? Because through PA school, you're a general practitioner.
Sort of fell into that too. Yeah. Truthfully, my like I said, my parents owned a real estate office. I was having a very hard time finding a job right out of school at the time because the guy who was in charge of IHC at the time had put a freeze on hiring any APPs. And at the time, they called them mid-level providers. Yeah. But they weren't hiring LPNs either, like licensed practical nurses. It was either you were an RN or you weren't a nurse. And either you were a doctor or you weren't a provider. Mm-hmm. So he kind of stopped doing all of that. And I was having a really hard time. I always figured I'd end up in Sanpete. My goal was to work in Sanpete, but I couldn't find a job. And I was a second away from taking a job in St. George. But my dad was selling a cabin for one of the doctors at this clinic that I ended up taking a job at. And the doctor had kind of in passing said, oh, I always kind of wanted to have a PA. And so I called him, and I had called him multiple times, and he'd never returned my call. So the last time I called him, I said, look, I'm going to take this job in St. George if I don't hear from you. So just so you know, if you don't call me by the end of the day. And I was literally walking to the phone to call St. George to say I'll take the job when my phone rang, and I picked it up, and it was him. And he said, just come tomorrow. We're just going to start you. I don't need to interview you.
Oh, wow.
Yeah. So I ended up working at that office for 22 years.
Wow.
Yeah.
That's
and
incredible.
It was weird because he was gone like a year after I started.
That physician?
Yeah, he left, and then the clinic just said, well, we like you. We'll keep you here. So
he's gone, but you can stay.
Yeah.
That's nice. You must have made an impression. Told everybody you're not wearing underwear, I guess.
No.
They remembered you.
No, that's not advisable. Don't do that.
That's not accurate advice. That was the disclaimer to start the show. It's not actual advice.
Not
Don't really
medical
say
advice,
that.
not accurate advice.
That's why we have the disclaimer.
It's bad for chafing, it's bad for your body, and not good to get into programs.
Not good hygiene, hygiene.
So what was that first year like? Like, were you just kind of thrown into the fire?
I don't know what it was like for you guys. But I think when you first get out of school, there's a part of you that is always really afraid you're going to kill somebody. You're like, oh my gosh. But luckily, I worked with this group of really seasoned doctors who if I didn't know, I could run to them and be like, hey, you know what I mean? So this is what I'm thinking. And they were very reassuring. A lot of the times they were like, no, you're right on point. This is what we would be wanting, and this is what you should be doing. And back then there was a little bit more, rigidity as far as oversight from physicians was concerned.
Sure.
I think at this point, and I don't know if this is true, but they say if you've been, because it used to be that only NPs could kind of hang out their own thing, but now I think PAs can do it if you have so many hours.
It's state by state.
Yeah,
and in
I'm
Utah,
not sure what it is.
in Utah, I can't remember the exact criteria, but it is a certain number of years.
Yeah.
And a certain amount of experience.
Yeah, so
you can get to that point.
Anyway, that first year was just they put me on salary, and it was not great, but it was more money than I'd ever made, and I was just excited to be a PA.
Yeah.
So it was good. Yeah.
And not killing people.
Not killing anyone.
I love it.
Never have.
That's great. Yeah. So tell us about kind of the day-to-day now at this point. So you've been in family medicine for a long time. So what's kind of the routine like? Tell us about your life.
So my routine at my previous place of 22 years was it's almost as far as schedule. When I left there, it's about the same. I work 4 days a week. I have 1 day off completely. I work the occasional Saturday. With my new place, it's a very short shift on Saturday. We're only open from 8 a.m. to noon on Saturday, so it's kind of good because it really doesn't interfere too much with your day. But it's pretty much 8 a.m., 5 p.m. with an hour off during the day for lunch, and you just see patients all day, and it's great. I love it.
How many patients are you seeing on average?
Well, at the last place where they were cracking the whip constantly to see more and more, it was anywhere from 25 to 30. Here, the U is a different culture. They're very centered on patient care, and I love it. I love that about the U.
University of Utah Health is what we're talking about.
University of Utah Health. Yeah, I work at the Parkway Health Center in Orem. But the entire place is just full of really great providers, and their culture is different. Right now I see between 20 and 24 a day, and they often are like, "Are you okay? Are you seeing too many?" I'm like, "This is so weird. You guys aren't yelling at me to see more." But it's the pay is different for me now because it's production. I'd never been on production, and production pay is good. You feel like you're getting paid for what you do. So
I love that.
And there's no cap on it. So
if you wanted to see more patients, you could.
Mm-hmm.
Oh, yeah.
So if they have a walk-in come in the middle of the day, and somebody comes back and says, "Hey, we have a waiting room's full and we have a walk-in. Do you think you could take one?" I'm just because of where I'm from, I'm usually like, "Yeah, absolutely, throw them on." Yeah.
What are the common things that you're seeing?
Well,
day
it's
to day?
typical family practice. So anything from newborn to geriatric, and everything from coughs and colds and conjunctivitis to diabetes and congestive heart failure, and just kind of routine maintenance stuff. And when we get in over our head, we kick them off to you guys. You know what I mean? Like, hey, I don't know. We got to get you to a specialist.
Yeah, and that's an interesting point, because we're on the opposite end of that dynamic and that relationship, being the subspecialist and seeing a very niche group of people.
Yeah.
It's kind of hard to remember the reverse of that, of somebody that has all of that at your exposure.
Family practice, I recommend. I've been part of the clinical staff for the U for a really long time. I don't know how many students I've had over the years, but I always tell them, when you come through, if you can, try to work in family practice right after graduation, because it really gets your feet wet. I know it's not the most glamorous position, it's not cardiothoracic surgery. It's not, you know what I mean? It's it's not ortho, it's not neuro, it's not these things that people are like, "Man, I get to do surgery every day." But, it's always played to my ADD, because I never know what's in the next room. I've got a depression case, and then I might have a laceration, and then I might have a rash, and then I might have a sinus infection, and then I might have, so every room is just a different thing, and it's great, and we do, from Nexplanon implants, IUD removal, insertion, and I've always said you kind of have to know a little bit of everything to do general practice.
Yeah, to me that feels stressful. I don't know about you, but I feel like I'm pretty task oriented. So if I get a list of things of, this is the type of pathology, or these are the types of patients that you're going to see in the clinic, to me it feels a little reassuring to it. I know I can just hone in on these things, get really good at this, and this is kind of what I'm going to see day to day. But your life, that honestly gives me a little bit of anxiety. I have no idea what's going to happen next.
It's really fun. I love what I do. And for me, the biggest deal is making relationships with my patients, because my general philosophy towards practice is, the minute you come into my room, the minute you're seeing me, you're now my family. How would I want my family to be treated is how I'm going to treat you. So what would I want done with my mom or my sister or my brother or my nephews or nieces or whatever? That's kind of my philosophy is if I treat you the same way I would want somebody else to treat my family, then I'm going to do the best I can for you.
Yeah.
And I like the establishment of relationships. I like it when I know people's families. It takes time. It takes a few different visits and, you know what I mean, repeated visits. You have those patients who come in hit or miss, and every now and then you make the mistake of being like, now have I seen you before? You know what I mean? Right. And they're like, yeah. But
count the number of times I've done that.
I know. It's terrible.
Once you really get to know them and you know their names and you know their families, and you can establish some really meaningful relationships that carry over the years.
You get to see people a lot.
Yeah, which is why I had so many people follow me.
Yeah. We get. I mean, what's the highest number of visits that you feel like you've seen one patient? How many times have you seen one patient, or what's the most visits with a single patient?
I was thinking about that the other day.
I bet I could count on probably one hand almost.
I probably have two hands.
Two hands?
There's a few that I've seen, and I've been in practice for 5 years, so some of these people you'll see early on, they'll do well, and then they might come back for a secondary problem.
Right.
So we see them in waves though for the most part.
It is waves.
We'll see them 3 or 4 visits, over a couple months or throughout the year, but then we might not ever see them again.
Yeah, and
your
what's
case,
fun for
totally
me
different.
now, going on as long as I've been doing this, is I'm seeing little kids I'm seeing people come in with their babies who I saw when they were babies.
Oh my God.
You know what I mean?
See that.
So it's really fun.
That's got to be gratifying, I'm sure.
It's cool. It's really cool. That's one of the best parts.
The connection with the community. I love that.
Yeah. That's kind of, I don't know. It's got my heart, I guess.
And then I was thinking when you were talking about the angst of seeing, such a wide variety of cases, but what I found in practice is that when you're meeting with a patient, oftentimes you're letting them tell you what's going on. Like I think we ask questions, thought-provoking questions, but oftentimes we're like, what's going on? Tell me what is it that you're experiencing? What are the symptoms you're having? And then obviously in the back of your mind, you're trying to put all the puzzle pieces together.
You're building a differential.
But I think you can always acknowledge like, hey, actually, I'm not sure what's going on, but you know what? I can look into this and we can get other parties involved and we can try to dive into this a little bit more.
And I say it to patients all the time, especially new patients, right? If I say, hey, I've known you for 10 minutes. I'm not going to know you as well as you know you.
That's
and if
exactly
a lot of fields of medicine, it's, you got to get them in and out a lot, especially in specialties, because they've got waiting lists that are months long and we got to go. But I always think that if you treat people like people and you let them tell you the story and you don't forget that they're a human being with a story, a lot of the times they'll tell you what's going on. They'll tell you what's wrong if you have ears to hear it.
If you're asking the right question, if you're hearing it.
Yeah. And sometimes just not interrupting them and letting them go for a minute will take you down. Some paths aren't discovered until you get lost, right? So you gotta wait for them to kind of be like, now where are you going with this? And then when they come back, you're like, oh, well, that's your depression's probably situational. You know what I mean? That kind of thing.
Yeah, it always sticks with me. Dr. Pitts, one of our orthopedists in the office, one time given one of his rounds discussions about the patient-physician communication interaction, said the average duration before the physician interrupts the patient is 15 seconds.
Yeah, oh my gosh.
Which is wild.
Yeah.
But on our end, as providers, you do feel a little bit of pressure because there's people waiting for you.
Yeah.
But it's a little bit hard to be present with the person and
I just think
that.
As long as your patient leaves feeling like they were heard and they were seen, then they're going to feel like they weren't just a number.
Yeah.
I think I was telling you at my last place, I really got worried because it felt like the pressure to see, more and more and more. And I used to say, if you treat people like cattle, eventually they're going to feel like they're going to the slaughterhouse. Yeah. And that I just can't do that. And I feel like, the man upstairs was watching out for me when I landed where I landed, because it's a really great place.
That's awesome. I'm happy to hear that for you. And it sounds like you're doing a great job. How about the opposite side of that coin? What are the bigger challenges or what are the difficult parts of being in primary care?
Gosh, I don't know. I always look at the upside. I guess the hardest parts about, the amount of forms and paperwork, because you're kind of frontline where people come in and they're like, I need an emotional support animal. I need you to fill out this paper.
Handicap placard.
I'm FMLA, right? Disability.
Yeah.
So the amount of paperwork can be a lot. And obviously, I don't know if anybody likes charting.
No.
But there's some exciting things happening in medicine with large language AI models, and
I've heard.
At the U we're using a program where it's on an app on your phone, and you come in and you let the patient know, I've got this app and it's going to help me with my charting. Are you okay? And if they say, yeah, you put it down, and you just, now I don't have to sit there and type the whole time that they're talking to me. I can just have this conversation, and the phone is listening and teleporting it into the chart. And so when you're done, your subjective is just amazing, because it's basically word for word from the patient what they're saying.
Yeah.
Yeah. And then your questions are in there, and their responses are in there, and it's
been a good thing then.
Yeah. Oh yeah. Point. No, and it's really cut down on my charting time.
That's
hugely.
Awesome.
He finds the positive and the negative.
I know.
We try to get a negative out of it.
He's talking about the happy things of charting.
I'm sorry. It's not that happy.
No, you're good.
I don't know. I think a lot of people in medicine kind of see general practice or family practice, and we do urgent care too, but they kind of see it as, that's what you do. I'm sorry. That seems a little boring. You know what I mean? But to me, it's really, I like the unknown of what's in the next room. So it works.
Going back to the bio, he put on one of his favorites, and you correct me if I'm wrong, but ingrown toenails.
I love ingrown toenails.
Oh my gosh,
yeah,
yes.
I love those.
So I have a story. When I was an orderly, there was an anesthesiologist walking around with a sandal on all day long, and I was like, what? I didn't understand why. I was like, what? Anyway, we get towards the end of the day, and I was with one of the surgeons turning over the room, and the anesthesiologist walks in. He's like, Doc, you got to fix me. You got to fix me. He's like, what's going on? He's like, I got an ingrown toenail, and it's got to be removed. So sure enough, he pops him up on the seat, blocks his toe, and proceeds to remove the ingrown toenail. And I was fascinated by it, because obviously as an orderly, I'm just barely gaining exposure to medicine and seeing this. And I'm not kidding you. He pulled out another toenail out of this guy's foot.
Yeah.
And I just felt like, I felt relief for this guy. I'm like, that had to have felt so good.
Yeah.
My thoughts with those, because I did a few, I don't do them now, obviously, but through schooling and training, we did a couple in the family care office.
Yeah.
And my first thought is, I'm pretty sure that's what I've seen in the movies, how they torture war prisoners.
Slide up underneath the nails.
Definitely.
Oh,
that's
my
where
goodness.
that block technique matters. But I love all procedures, actually. I almost, if I get to cut off a mole or do a laceration or an ingrown toenail or whatever, that's great. That's good for me. I love that.
I bet.
And I used to get, at my old place, the doctors got to where they sent me all their toenails. You know what I mean? They were just like, just have Steve do it.
Steve will do it. He'll torture some guys, pull their toenails out.
I got a really good record with toenails.
Hey.
So I don't mind tooting my own horn there. I'm
I know where
pretty good
to
at
go.
toenails.
And it's different. I spent a couple years in Mexico on a religious mission.
Nice.
And I had an ingrown toenail as a missionary.
Yeah.
And in the heart of Mexico, there's not great health care.
So you dug it out yourself.
Well, I tried for a couple months.
Yeah.
And eventually one of my companions, who was a native, convinced me. He's like, I know there's a doctor down the street. Let's just go down and let him do it. And by that point, I was pretty callous to the culture and the economy and things. I was like, okay, fine, whatever. Went in there. Sure enough, we knock on a sketchy door in a back alley, and they just let us in. It's a single room. They have a dentist chair in the middle of the room.
Nice.
They're like, take a seat. We got you taken care of. And I'm getting extremely suspicious by this point, but I think I'm too far.
The lights are flickering.
Keeping his mouth closed tight. Doesn't want any teeth removed.
Exactly. We were past the point of no return. And I didn't know anything about medicine at that point. But they tried to do the local anesthesia, and it wasn't a digit block, I have since learned. They went straight into the point of my toe, like into the nail bed.
Oh, I bet that felt so good.
And you can feel, your anatomy is pretty superficial. You can feel the needle bounce off of the bone. And I eventually passed out, I'll admit.
Oh, wow.
I went out. And I wake up, and my companion that I was with is shaking my shoulders. Wake up! Wake up! He had no idea what was going on either. He thought I was dead. And I wake up, and the provider, physician, I don't know what that person was, but they're like, well, you fell asleep, so we went and just did it while you were asleep. So you're all done. Off you go.
Great. Did it work out?
No.
It got infected.
Definitely not.
You had problems?
No, it grew back.
Oh,
So
I took out my own ingrown toenail.
Oh, that's awful. Did you block yourself?
Yeah, blocked myself.
Oh, I don't think I could do it.
That's the way to do it.
I worked with a doctor who did his own vasectomy.
No.
Over 2 different weeks.
What?
Did one side one week, did the other side the next week.
Oh my God.
No
This
way.
is way back in the day, and he's since retired. But again, one of my heroes.
Got a mirror
Absolutely
and all
love
that
it.
stuff,
He
huh?
did. He actually used a bench and a mirror and put it against the wall
man.
and did it.
Kudos to him. That's
What?
that's bravery.
Yeah. This
Oh
is
my
back in the
goodness.
day. I don't think anybody would do it now. But
I
yeah,
love
it's pretty
it.
crazy.
I love it.
That's crazy.
Old school. I love
yeah,
it.
that's kind of the old
When men were
mentality.
men.
Yeah, the old
Yes.
mentality. Maverick, just figure it out and MacGyver it, and
I ain't got time for this. I'm just going to
Yeah.
do
just
it
gonna
over
do
a
it
couple
myself.
days. Yeah.
that's crazy.
Sorry.
That's a distraction.
Sorry.
Okay, I got to flush that one out. Okay, somebody doing their own vasectomy.
Yeah, you can cut that.
No, we're keeping that.
Okay, how about this topic? This is a fun one. In family medicine, trendy topics. So in my mind, I didn't think so much that the medicine is getting trendy, because I think it's as stable and scientific and foundational as it gets. But I feel like the patients are getting trendy with the advent of social media and people, I imagine, coming into your office
The amount of
telling
people you come in and
they tell you what they need.
I'm a little overweight and I need some semaglutide.
Exactly.
Yeah, and you're like,
Is that a
"Oh,
thing now?"
You know that word. And that's the thing. You get a lot of people who come in wanting semaglutide or Mounjaro, tirzepatide, or you get a lot. And then, of course, Adderall. You got a lot of people who want Adderall. So you have to be pretty judicious, and you have to, there's this weird point where you go, okay, I can see where semaglutide has its benefits for people. It's better to keep you from getting diabetes if you're morbidly obese. It's a good thing, in a way, and that's great. But you have to tell people, look, this isn't a fix-all. This is, if you don't change your relationship with food and exercise and your lifestyle doesn't change, you're not going to keep buying this forever because you don't have diabetes. Your insurance isn't going to pay for it.
Yeah.
And so are you going to shell out a couple $100 minimum, some places more, every month to do this forever? Because once you stop, if you haven't changed that relationship, all your weight's coming back.
Yeah.
Yep.
But I see what you're saying. We get a lot of people. And what's weird is that I'm kind of a weird niche guy. I know some stuff about some weird conditions like lipedema and Derkham's disease and different things that just because my wife has made me a very good provider. She's kind of a medical mystery. She's So she's got myasthenia gravis and she's got all kinds of stuff in it. But I like just yesterday, I had somebody who I was seeing from Wyoming, who came from Wyoming, to come down and see me because they needed a provider who knew something about lipedema.
Oh, wow.
Yeah. So it's, it's weird. And that person found me because of social media. You know what I mean? So it's weird. Yeah. Word of mouth and what kind of, whatever the soup du jour of medicine is right now. And that kind of
You
stuff.
being the front lines, you're hearing about it all too.
And you get it all day. Yeah.
I'm sure
All
you
day
wouldn't even
long.
have to check social media. I'm sure you could know what the trends are.
Well,
based off of what's
eventually,
happening.
if you're not on it much, eventually you start catching on because
Yeah.
you're like, oh, well, must be what's going on.
Yeah, must be what's getting
Yeah.
spread around. How about we'll finish up here. We've been having a good chat. This has been a lot of fun. No, this has been a ton of fun. How about to finish this up with some story time? How about
I don't know if any are appropriate. I don't like most
Well, we got
medical
the vasectomy
story
out
are
of
a
the way,
little
so-
like,
That's true. That's
I mean,
true.
I could tell
it's a
you
good icebreaker.
I could tell you I fish stuff out of orifices. I could tell you about the little kid who gave me my nickname and my email. I was sewing up this little boy who had been jumping on a couch and somehow hit his head on a thermostat on the wall.
Okay.
sharp.
Yeah,
And
like the corner.
and he cut his eyebrow open. And so I'm sewing him up, and at the time I'm wearing green scrubs. And he was being very brave. He's holding his dad's hand, and he'd look at me, and then he'd look at his dad, and he'd look at me, and he'd look at his dad. And I'm sewing him up, and I turned around to grab something off the tray. And as I turned around, I heard him go, Dad, look at that guy. And his dad goes, why? What's wrong? And he goes, he looks just like Shrek. So I made the mistake of telling, some people
Yeah,
that. And
that
the
spread
next thing
like
I know,
wildfire.
it's like,
That's the
oh,
nickname.
yeah. So there's that
Well, thanks for
story.
sharing.
And then I had a lady who came in with her mother. And she was there for a different thing, but she during the history, she had told me she'd given birth a few months earlier. And so when I was going to prescribe medication, I asked her, "Are you nursing?" And she said, "No, she cut me off years ago." And I just died laughing. And that's what I love about them. I love the patients.
Awesome.
I love their
Yes.
humor. Yeah, it's really great.
That's awesome.
I love that.
Well, this has been fantastic, Steve. We're happy to have you here. I've learned a
I'm glad
ton.
to be here.
Tyler, what do you think? What did you learn today?
Man, that was great.
Yeah.
I learned about doing your own vasectomy. I think I can't get off
Yeah,
of that.
yeah. We didn't talk about pay or anything. But
Oh,
yeah,
that's okay.
all
That's
good.
okay.
No, but I really like I think the story. I think you have a unique story as far as how you got involved in medicine from an early age and just kind of stuck with it. And to getting in, first exam, I think we can all appreciate that anxiety and angst when you get that letter in the mail about being accepted or not
Yeah.
accepted. So really unique story. You've been super diligent about being in family medicine. It sounds like you're passionate about it. You love what you do.
I do.
And I think the patients in our community are the benefactors in that. So we appreciate you and all that you do.
That's
and
nice.
we
Thanks.
want to support you. And so shout out to Steve. He's got 5 stars. We'll keep that 5-star rating up. And
All right.
yeah, we appreciate your time, though. I really do.
Thanks for having me.
Absolutely. How would, if we had another provider, a patient, or somebody listening here that wanted to follow up and had some questions for you, how would somebody reach out to you?
I can be found at the University of Utah Parkway Health Center in Orem, right there across from Lowe's and by Golden Corral. It's just kind of tucked away, but it's a nice clinic. You can find me. Well, I don't know that I have any kind of a professional. Like Steve PA on
Yeah.
Instagram or anything. I don't have anything like that. I just have
That's
my
okay.
personal, my stuff. So I don't know that anybody would want to reach out to me on that. But, you can
Okay.
look up my name and I'm there. I'm old, so I mostly Facebook. I guess
Yeah.
I also have an Instagram, but I
thought
know.
you were gonna say
I don't know how to
MySpace.
use it. No, I remember MySpace, but I was a
Me
little.
too.
I didn't get into that. Yeah,
No, that's great. That's great. Well, with our clinic, Summit Brain and Spine, you can find us on Instagram, Summit Brain, Spine, and Orthopedics. Our YouTube channel is the Summit Medical Institute. And as always, we'd love to see people here in person. We're here at the Mountain Point Hospital in Lehigh, Utah, every Tuesday morning at 7 a.m. for our interdisciplinary case discussions. A special shout out to our production team, as always, for putting this together behind the scenes. We'd love to have the help. And our audience that may or may not be listening, we'd love to hear from you. Let us know what's been working well. What do you like? What do you want to hear about? And maybe a guest, or what specialty would you want to have on the show next?
We got some good ones coming
And
up.
I think this is a cool thing you guys are doing, this interdisciplinary thing.
Oh, appreciate it.
Yeah, that's awesome. Good job.
Yeah, thank you.
Yeah,
Yeah,
I
it's
hope
been
it
a lot of
grows
fun.
for you. That's cool.
I appreciate it. It's been a lot of fun. We look forward to the more episodes, many more to come, all the different specialties. We think every other week puts us at about 25, 27 episodes in a year, so that's a lot of different specialties we'll get to.
That'll be cool.
That'll be
And
cool.
we'll circle back to.
We'll
We'll,
circle
do
back.
a part 2, Steve.
I'll be glad to come.
All right.
Sure.
Can't wait.
Maybe yeah. Okay. That'll be great.
Share more stories.
I'll talk less.
No, you've been great. You've been great. Well, this has been another episode of the Many Minds podcast, where we encourage community collaborative healthcare using many minds for better outcomes. I'm Alex Davis,
I'm Tyler Murray.
and we'll see you next time. Thanks for hanging out with us.